Hello everyone, welcome back to my YouTube channel My Cup of PT. Today I will be discussing three spine conditions with you guys. The first is spondylosis, the another is spondylolisthesis and the third is spondylolysis. So starting with the first condition, that is spondylosis. It is a degenerative condition affecting the spine involving the wear and tear of spinal disc and the joints. Basically, it is type of arthritis in which there is wear and tear of spinal disc as well as the joints. Coming to the location part, primarily it involves the vertebral disc and the facet joints. So here I would like to add that as person ages, the disc become drier and thinner, and also sometimes it becomes harder. So by this, the disc lose its ability, that is cushioning ability. So because of that only, it is more common. The spondylosis is more common in older age group than the younger age group. Coming to the symptoms, there is pain, stiffness, reduced range of motion and the potential nerve compression. Okay. Coming to the causes, it is basically due to aging. As I have told you earlier that it occurs because of the aging and wear and tear, genetics, injury and poor posture. Coming to the diagnosis part, the medical history is required from the patient, physical examination is done and the imaging studies include x-rays and the MRIs. Coming to the treatment, so conservative approaches like physical therapy, pain management and lifestyle modifications are guided to the patients. Okay, coming to the spondylolisthesis. In this, there is slipping or displacement of one vertebra over the another, which cause the spinal misalignment. Okay, it typically occurs in the lumbar region but can affect other areas of spine. And if I talk about the spondylosis, here I would like to add that it generally occurs in the cervical region, but it doesn't mean that it can't affect the other parts of the spine. Okay, coming to the symptoms of spondylolisthesis. The symptoms varies based on the slippage. If there is anterior slippage, then we usually say that it is anterolisthesis. If there is posterior, then retrolisthesis. Okay, so the symptoms varies based on the degree of the slippage, and it may include the back pain, muscle tightness, and the neurological symptoms. If I talk about the causes, it can be trauma, degenerative condition, congenital factors, and sometimes unknown causes. Idiopathic spondylolisthesis can happen, and idiopathic means unknown causes. Okay. Imaging studies like X-rays, CT scan, or MRI are used to assess the extent of the vertebral displacement. Okay. Coming to the treatment, depending on the severity, it involves bracing, physical therapy as well as the surgical intervention. Surgical interventions are mostly common in this spondylolisthesis. Now coming to the last one, that is spondylolysis. So I would like to tell you guys that lysis means breakage. Any breakage is there. Okay, so spondylolysis is a stress fracture through pars interarticularis of the lumbar vertebra. And what is pars interarticularis? It is a thin bone segment joining the two vertebrae. Everybody has seen that Scottish dog sign and the pars interarticularis defect. Okay, so this is the main definition of the spondylolysis. In this way you can remember is that lysis means breakage, so any fracture in spine or the mainly the pars intercalaris of lumbar vertebra is fractured, so it is spondylolysis. Now talking about the location, mainly localized to the pars interarticularis of the lumbar vertebra. This is something that we have already discussed. Okay. Now coming to the symptoms part. Pain across the lower back feels like a muscle strain. Patient will tell you that it feels like very stiff area or muscle strain is there. Okay, and even the pain get worse with the extension. Patient will tell you if he is standing for the long hour, if he is walking, anything that involves the overextension of the spine, he will tell you that at that time particularly he is suffering from pain. Okay. Now talking about the causes, often associated with the stress fracture in pars interarticularis leading to the lysis or the structural weakness. So mainly in this we have to focus mainly on the pars interarticularis defect that happens because of the stress fractures and everything. Okay. Now diagnosis. It is diagnosed through the X-ray and the MRI, and other procedures can also be used, but in X-ray it's very prominently seen that there is a defect of pars interarticularis in lumbar region. Okay, and if I talk about treatment focuses on addressing the underlying causes, which involve rest, bracing, surgical options, particularly for fractures of the pars interarticularis. So this is all about these three conditions. Okay, thank you for watching. If this video was helpful to you guys, please hit the like button and do subscribe to my channel. Thank you.